Hey everybody, Dr. Angie here. Today I wanted to talk about testosterone therapy for women. So everybody talks about testosterone therapy for men, and we all know why testosterone therapy for men can be helpful. And when men have low T, it can cause a lot of symptoms, and they feel so much better after getting on testosterone therapy. But often a missing piece is that women get kind of forgotten about with testosterone. And a lot of physicians will only test progesterone and all the estrogens in women and the testosterone for men. And the truth of the matter is that all of us need and have use for all of our hormones. So men need estrogen and progesterone, and women need testosterone. And this is really, really important for later in life when we're talking about bone fractures. So it is a fact that men do not have as many fractures when they get old as women do. Women have the highest rate of hip fractures, and oftentimes hip fractures can lead to death due to immobility, and that leads to pneumonia. And oftentimes hip fractures they're kind of like the precursor to death early. So we want to prevent that as much as possible. And there's been a lot of misinformation about bone density being linked to estrogen. And while there is some truth to that, it's actually more linked to testosterone. So if a woman has too low of testosterone, testosterone helps with muscle mass and it helps with bone density. So one of the things that I do with my female patients is I absolutely test testosterone, not only the total, but also the free. So total testosterone is what we have made in our body, but it can be bound or unbound to proteins. So if it's bound to protein, you actually can't use it. So I run a total testosterone, but I also run a free. If it is not bound to protein, it's your free testosterone, and that's what you have access to. That's what you can use for muscle mass and bone density and energy. So both of those are really important to test, and I test that in all of my female patients. And then we look at the ratios of testosterone, estrogen, and progesterone. And adding a little bit of testosterone for women can be extremely beneficial for the long-term health of women and their bones. So if you guys have never had that tested before, ask your doctor or come and see me. We'll run all of your hormones and we'll get you all fixed up. I hope this helps. Have a great day, you guys.